Are your bones getting weaker? The truth about bone density. We often associate strength with the visible power of our muscles or the endurance of our heart. But the true foundation of all our movement, the silent, steadfast framework that supports our entire body, is our skeleton. For millions of women, especially after the age of 50, this internal architecture is at risk from a condition that operates in stealth mode, giving no warning signs until a crisis occurs. This condition is osteoporosis, a disease that literally means porous bone. It is rightfully called the silent disease because it can advance for years without causing a single ache or pain, quietly thinning your bones from the inside out. The first symptom is often the sharp, sudden pain of a broken bone from a minor fall or a simple everyday movement. The reality for women over 50 is stark. An estimated 1 in 5 will be affected by this disease. The consequences are not trivial. A fracture of the wrist, spine, or hip can lead to chronic pain, a stooped posture, a significant loss of mobility, and a profound fear of falling that can shrink one's world. This increased vulnerability is not a random occurrence. It is a direct consequence of the hormonal shifts of menopause, a time when a woman's natural bone-protecting mechanisms are dramatically reduced. However, this is not a story of inevitable decline. It is a call to action. Osteoporosis is a disease that can be anticipated, prevented, and managed. The key is to understand what is happening inside your bones, to recognize the subtle signs of weakness, and to adopt a proactive strategy to defend your skeletal strength. This guide is designed to give you a deep and clear understanding of bone density, what it is, how it affects your body, how to foresee and prevent its loss, and how to live a full and less painful life if your bones have already started to weaken. What is bone density? Your body's inner fortress. To understand the threat of osteoporosis, you must first understand the nature of bone itself. Your bones are not static, lifeless objects. They are living, dynamic tissues in a constant state of renewal. This process, called bone remodeling, involves two teams of specialized cells. The first team, the osteoclasts, acts as a demolition crew, seeking out and dissolving old, worn-out bone. The second team, the osteoblasts, is the construction crew, responsible for building fresh, strong bone to replace what was removed. In your youth, your construction crew is far more active than your demolition crew, allowing you to build a dense, strong skeleton. You reach your peak bone mass, the strongest your bones will ever be, in your late 20s. This is your bone inheritance, the wealth you accumulate in your skeletal bank account. After this peak, the two teams work in a more balanced fashion for many years. Bone density is a measurement of the amount of mineral, primarily calcium and phosphorus, packed into a given volume of your bone. Think of the internal structure of a healthy bone like a dense, tightly woven honeycomb. The walls of this honeycomb are thick, and the spaces are small. This structure is incredibly strong yet lightweight. When you begin to lose bone density, it is as if the walls of that honeycomb are becoming thinner, and the spaces are becoming larger. It is not just that the walls thin, the intricate cross-connections that provide support also begin to break down and disappear. The overall structure becomes more porous, less dense, and significantly weaker. This loss of internal architecture is what makes the bone fragile and susceptible to fracture. A bone with low density can break under stresses that a healthy bone would easily withstand. This internal weakening affects two types of bone tissue. The dense, hard outer shell of your bones is called cortical bone. The spongy, honeycomb-like interior is called trabecular bone. Osteoporosis disproportionately affects the trabecular bone first because it has a higher rate of turnover, making it more vulnerable when the remodeling process becomes unbalanced. The silent symptoms: how to recognize weakening bones. The most dangerous aspect of losing bone density is that you cannot feel it happening. The process is entirely painless. There is no dull ache or sharp pain that signals your bones are becoming more porous. However, as osteoporosis progresses and your bones become significantly weaker, several signs and symptoms may begin to appear. Recognizing these is crucial, as they are often the first outward clues that your internal framework is in trouble. Learning to listen to your body and notice these subtle changes is a key part of proactive health management. A fracture from a minor incident. This is the most common and definitive first sign of osteoporosis. It is known as a fragility fracture, meaning a broken bone that occurs from a fall from standing height or less, or from a minor trauma that would not normally cause a fracture in a healthy person. This is not a break from a serious car accident or a fall from a ladder. This is a fracture from a simple, everyday event. Breaking a wrist when you slip on a patch of ice, fracturing a hip by bumping into a piece of furniture, or breaking a bone in your foot by stepping off a curb awkwardly are all major red flags that your underlying bone structure is compromised. These events should never be dismissed as simple bad luck, especially after the age of 50. They are a loud alarm bell from your skeleton, signaling that its structural integrity has been critically weakened and that a conversation with your doctor about bone density is urgently needed. Loss of height. Over time, you may notice that you are getting shorter, that your clothes seem to fit differently, or that you can no longer reach the top shelf you once could. While we often joke about shrinking with age, a noticeable loss of height is not a normal part of the aging process. It is one of the most significant and visible signs of advancing osteoporosis, and it is caused by fractures in your spine. The bones that make up your spinal column, called vertebrae, are particularly susceptible to the effects of bone loss. As osteoporosis weakens the internal honeycomb structure of these bones, they can become too fragile to support the normal weight of your body. Under this everyday pressure, the front part of the vertebra can begin to collapse or compress. This is known as a vertebral compression fracture. Often these fractures are silent, meaning they happen gradually without a specific injury and without causing any sharp, immediate pain. You may have several of these tiny collapses without ever knowing it. Think of it like a stack of soft building blocks. Over time, the ones at the bottom start to get squashed, and the whole stack becomes shorter. A single tiny compression fracture might not be noticeable. However, as multiple vertebrae in your spine suffer these small collapses over time, the cumulative effect is a shortening of the entire spinal column. This is why tracking your height is so important. Losing 1.5 inches or more from your tallest adult height is a significant warning sign that should be discussed with your doctor immediately. It is a clear indication that your spine is being affected by bone loss. You can track this yourself by having your height measured accurately and consistently at your annual checkup. This simple measurement is one of the most powerful, non-invasive screening tools we have for detecting the progression of this silent disease. A stooped or curved posture. As the vertebrae in the upper back weaken and collapse, it can lead to a forward curving of the spine. This condition, known as kyphosis, is what causes the characteristic dowager's hump often seen in older women with advanced osteoporosis. This is not just a cosmetic issue, it can cause chronic back pain, throw off your balance, and even restrict breathing by reducing the space in your chest cavity for your lungs to expand. The change in posture can also lead to digestive issues as the abdomen becomes compressed. This stooping is a visible sign of the cumulative effect of multiple small fractures in the spine, each one contributing to a gradual change in your body's alignment. Sudden, severe back pain. While the compression fractures in the spine are often painless, they can sometimes be acute and intensely painful. A sudden, sharp pain in your back that occurs without any significant injury, perhaps while lifting a bag of groceries or simply twisting the wrong way, could be a sign of a vertebral fracture. This pain can be debilitating and may radiate around to the sides of your body, often being mistaken for a pulled muscle. Unlike a muscle strain, which may develop gradually, the pain from a vertebral fracture is often immediate and severe, making it difficult to stand, walk, or even find a comfortable position. Receding gums. Your jawbone supports your teeth, and it can also lose bone density just like any other bone in your body. As the jawbone weakens and loses its mineral content, your gums may begin to recede. While there can be many dental causes for this, such as gum disease, significant gum recession can sometimes be a clue to systemic bone loss throughout your body. Your dentist may be the first person to notice changes in your jawbone on a dental X-ray, observing a less dense appearance than in previous years. For women who wear dentures, a common sign of jawbone loss is that the dentures become loose and no longer fit properly. While you should always see your dentist to rule out oral health issues, if you are a postmenopausal woman with other risk factors, this could be an important piece of the puzzle. Foreseeing the risk, how to predict and prevent bone loss. Because the symptoms of weak bones only appear after significant damage has occurred, the key to avoiding fractures is to foresee and prevent the problem before it starts. This involves a deep and honest assessment of your personal risk and using modern diagnostic tools to get a clear picture of your bone health. Prevention is a far more effective strategy than trying to rebuild bone that has already been lost. A proactive approach is your best defense against this silent disease. Know your personal risk factors. Your risk for osteoporosis is a combination of factors you cannot change and those you can. Understanding both is crucial. Non-modifiable risks. These are the factors you are born with. Being female is the most significant, as women typically have smaller, thinner bones than men to begin with. Older age is another, as bone loss is a natural part of the aging process. Your family history is a powerful clue. If your mother or father had osteoporosis or fractured a hip, your own risk is substantially higher, suggesting a genetic predisposition. Having a small, thin body frame also means you have less bone mass to lose before you reach a critical point of fragility. Modifiable risks. These are the lifestyle factors that are within your power to change. A diet consistently low in calcium and vitamin D starves your bones of their essential building materials. A sedentary lifestyle with little weight-bearing activity fails to send the necessary signals to your bones to stay strong. Smoking is directly toxic to your bone-building cells and also reduces your body's estrogen levels. Excessive alcohol consumption interferes with your body's ability to absorb calcium and can disrupt the hormones that regulate bone health. Medical risks. Certain medical conditions, such as rheumatoid arthritis, celiac disease, inflammatory bowel disease, and kidney or liver disease, can interfere with nutrient absorption or increase inflammation, both of which are bad for bones. Similarly, some medications can accelerate bone loss. Long-term use of steroid medications like prednisone is a major culprit, as are certain drugs used to treat seizures, depression, and some types of cancer. It is vital to have an open conversation with your doctor about how your other health conditions and medications may be impacting your skeleton. The DEXA scan, your bone blueprint. The only way to truly know the state of your bone density is to have it measured. The gold standard for this is the dual energy X-ray absorptiometry scan, or DEXA scan. This quick, painless, and low radiation test provides you with a T-score, which compares your bone density to that of a healthy young adult. This score tells you if your bones are normal, if you have low bone mass, a condition called osteopenia, or if you have osteoporosis. This information is critical for foreseeing your fracture risk and making informed decisions about prevention and treatment. Think of it as a personalized weather forecast for your bones. It lets you know if a storm is coming so you can prepare. A proactive prevention plan. The best time to prevent osteoporosis is throughout your life, but it is never too late to start. The cornerstones of prevention are nutrition and exercise. Your diet must provide the raw materials your bones need, including adequate calcium, vitamin D, and protein. Your exercise routine must include both weight-bearing activities, like brisk walking or dancing, to signal your bones to become denser, and muscle-strengthening exercises to improve your balance and prevent falls. Quitting smoking and limiting alcohol intake are also crucial steps, as both of these habits are directly toxic to your bone-building cells. This plan is not about a temporary fix, it is about adopting a lifelong commitment to the health of your internal framework. Living with low bone density, a guide to a stronger, less painful life. If you have already been diagnosed with osteopenia or osteoporosis, it is not a sentence to a frail and painful life. It is a call to become a proactive manager of your health. The goal is twofold: to slow down further bone loss and to prevent the fractures that cause pain and disability. With the right approach, you can continue to live a full, active, and vibrant life. This involves a partnership with your medical team and a commitment to creating a safe and supportive environment for yourself. Work with your doctor. Your doctor is your most important partner. They can help you create a comprehensive plan that may include lifestyle changes, supplements, and, if necessary, effective medications that can slow bone loss or even help to build new bone. Regular follow-up DEXA scans can monitor your progress and help to ensure your treatment plan is working. Be an active participant in these conversations. Ask questions, understand your treatment options, and make sure the plan feels right for you. Managing pain from fractures. If you have experienced painful vertebral fractures, managing that pain is a priority. This is often a multifaceted approach that goes beyond just taking a pill. Physical therapy. A skilled therapist can teach you specific exercises to strengthen the muscles that support your spine, which can significantly reduce pain and improve your posture. They can also teach you proper body mechanics, showing you how to move, bend, and lift in ways that protect your back from further injury. For example, learning to bend at your knees instead of your waist when picking something up can take a great deal of pressure off your spine. Heat and cold therapy. Simple tools like warm baths, heating pads, or cold packs can be very effective. Heat can help to relax tense, sore muscles, while cold can help to reduce acute inflammation and numb sharp pain. Mind-body techniques. Mindfulness, meditation, and deep breathing can be powerful tools for managing the experience of chronic pain. These practices do not necessarily make the pain disappear, but they can change your relationship to it, helping to calm the nervous system's response to pain signals and reducing the fear and anxiety that often accompany chronic pain. Fall prevention is fracture prevention. For someone with low bone density, preventing falls is the single most important thing you can do to prevent fractures. This involves a conscious effort to make both your body and your environment safer. It is about creating a personal safety net that reduces your risk every single day. Make your home a safe zone. Go through your home room by room and eliminate tripping hazards. Remove loose rugs, secure electrical cords, and clear clutter from walkways. Install grab bars in the bathroom, both in the shower and near the toilet. Ensure your home is well lit, especially the pathways you use at night, from your bed to the bathroom. Use non-slip mats in the bathtub and on the kitchen floor. Strengthen your balance. This is a critical, active component of your fall prevention strategy. As we age, our natural sense of balance can decline due to changes in vision, inner ear function, and proprioception, which is your body's sense of its position in space. The good news is that balance is a skill that can be trained and improved at any age. A physical therapist can be an invaluable resource, designing a program of specific exercises tailored to your ability level. A popular and highly effective practice is Tai Chi. This gentle, mindful martial art involves slow, flowing movements that have been proven in numerous studies to improve balance, increase strength, and significantly reduce the risk of falls in older adults. You can also incorporate simple balance exercises into your daily routine at home. Start by standing on one foot while holding onto a sturdy counter or chair for support. As you get more stable, try letting go for a few seconds at a time. You can then progress to more challenging exercises, such as tandem stance, where you stand with one foot directly in front of the other, as if on a tightrope, or heel-to-toe walking. The key is to start slowly and safely, always having something sturdy to hold onto. The stronger and more stable you are, the better you will be able to recover from an unexpected stumble without falling. Oh, be mindful of your movements. Pay attention when you are walking, especially on uneven surfaces or in unfamiliar places. Wear sturdy, low-heeled shoes with good traction. Avoid wearing socks or slippers with smooth soles on wood or tile floors. When you get up from a chair or from bed, do so slowly to avoid dizziness. Have your vision and hearing checked regularly, as impairments in either can increase your risk of falling. By taking these proactive steps, you can live a full, active, and confident life, even with a diagnosis of low bone density. It is about shifting your focus from the fear of what might happen to the empowerment of what you can do to protect yourself.